We wanted to visit something that had happened. We've been talking about this yesterday. It was got a little bit controversial. Some updates today, and that's the number of employees and former directors of the Center for Disease Control that have either resigned or are now reaching out to Health Secretary Robert Kennedy and asking that he resign. They are concerned about some things that he's done with respect to vaccines, what that he's done with respect to the committee that oversees vaccines, and it's really been something that continues to grow and grow and grow. And as you mentioned to me earlier, Holly, there are now some 1,000 current or previous CDC employees who are seeking his resignation.
Yeah, that's right. And it's more than 1,000. They've signed on to a letter asking him to resign and then asking the president and Congress to remove him from office if he does not resign. So this comes after, we mentioned this yesterday, but 9 former CDC directors have cited Kennedy's actions, including changes to vaccine policies and the recent firing of the CDC Director. They say they're endangering Americans' health. And one of them, Dr. Richard Besser, spoke with ABC News about this.
We have grave concerns that the Secretary of Health is endangering the health of people across our nation by not letting the agency do its job, not following the science, and putting out guidance around COVID vaccine that is leading to confusion.
So he served as the acting director of the CDC in 2009. And those who signed on to that op-ed represented leadership that went all the way back to the mid-'70s under Jimmy Carter.
Kennedy does have some Republican support, including Louisiana Senator Bill Cassidy, a medical doctor who says, hey, we just need to give him a chance.
People are going to try and make this something more than it is. I'm not presupposing anyone is right or wrong. I am saying we got to get to the truth, because there's serious allegations. And so that will take radical transparency.
So radical transparency, what a concept. Lois Collins is on the line with us. She's a reporter from the Deseret News. And Lois, what is your take as you see the 9 former CDC directors, but also now this morning I'm seeing over 1,000 employees calling for his resignation?
Well, and there's a third piece of, actually, there are 2 more pieces of news that came out today about it. The first one is that the West Coast states, Oregon, California, and Washington, are going to come up with their own policy on vaccines in a health alliance, and they're going to ignore the CDC because they say it's in chaos. And the other piece of news is that one of the most renowned vaccine experts in the country, Paul Offit from Philadelphia Children's Hospital, was removed from the panel. He was literally locked out from the advisory panel. So it's chaos. My take on it is I don't know what to think about anything. I think there's a lot of angst because Robert Kennedy Jr. is not a scientist and he doesn't have any medical background. He's an environmental lawyer, and I think that put him at a disadvantage as far as being taken seriously by medical experts in the beginning. And he keeps citing research that was debunked, which also doesn't help make him look like a really strong expert. And so it's a very contentious battle right now. And we've always counted on the CDC as our big public health agency to give us science and health information that we can trust. And we can't tell what's trustworthy right now.
Lois, he also, Health Secretary Robert F. Kennedy Jr., seems to still have the backing of President Trump. Are we seeing or hearing anything that would give the impression that that's starting to crumble in any way?
I don't think so. I have not seen anything. I think that he's doubled down on his support. He said from the very beginning that he was going to allow Kennedy to, quote, go wild on health. And I think part of the concern is that it's not just about vaccines. Not only have tons of experts been fired and a bunch of others have resigned from the CDC, but grants, research, academic institutions that were making progress on diseases that affect a lot of people have been kind of stalled or have been cut back. And so it started with DOGE, with the Department of Government Efficiency. And so everything's just kind of chaotic right now. So it's well beyond vaccines. It's not just vaccines that there's concern about.
So if there's a growing cry from people who have worked within the organization to say he's not the right person to lead this department, really. At what point do we move past they're just biased to, maybe there's something here? Do you have any kind of feel at all? Because it has become
really,
political.
It's really interesting. It started out political. It has always, this particular issue has always been somewhat political, with people divided very strongly in their feelings. And if you talk to the scientists and health experts, they disagree somewhat too, although most people believe that vaccines have been our real victory as a country. We have come up with some great vaccines and we've saved millions of lives, and you hear that over and over and over. And I'm not a scientist, but I've read a lot of the science, and I got to tell you that I personally want my science pure. I don't want politics in it. I want studies and evidence and data, and I think that there's a risk in all of this political chaos that we're going to lose that. And I think that that is troublesome to a lot of people. As far as when do we move, into a place where we say this is bad, I guess when you get a pandemic that you don't do anything about, or I don't know.
Lois, you mentioned
it's very hard to cover.
Yeah, the West Coast states sort of taking their own lead on this. What do you hear about that? And I know maybe you don't know the answer to this, but I'm kind of wondering what authority they have, what they can do.
They don't know what they can do either. Nobody knows.
Right.
I mean, we just were told recently that like CVS and Walgreens will not provide vaccines without a prescription if you don't fit in certain states, and in other states it will. So every state's a little bit different, but it is not clear if insurance will cover vaccines that are not on the recommendation from the federal government. It is not clear if providers will provide vaccine for fear that they might face some consequences. So we don't know if doctors will prescribe them to people who are not on the list for whom it's recommended, or if pharmacies will have the vaccines available for people for whom it's not recommended. We don't know any of that stuff yet. And we have not known since May whether or not, if you are, quote, healthy young person between, ages of 6 years old to 64, we don't know if you can get it regardless. We don't know. It's all kind of up in the air, and it's really strange from a consumer viewpoint, just because you've always been able to get it or get an exemption to not get a vaccine. There's always been a mechanism for what your ideology is, and now there doesn't seem to be a mechanism if your ideology does not align with the guidance coming out of the federal government.
One last quick question, Lois. Are you seeing any of that chaos start to filter into Utah? I mean,
I did a story not too long ago. There's a great deal of concern among pediatricians here over the guidance of what they should tell their patients, what they can tell their patients. Pediatricians, the American Academy of Pediatricians, which is the largest organization, it includes probably 80% of all pediatricians in the country, very strongly feel that the guidance that's coming out of the federal government is wrong regarding kids. Kids can get long COVID. Kids can die. They died during COVID. So there's a lot of feeling in Utah as well, and they have been very vocal. And there are also states that are suing. The pediatrics group is suing the federal government. It's just kind of chaotic right now.
Thank you, Lois. That was Lois Collins, Deseret News special projects writer. And when we come back, a gymnastics coach is being sentenced to both state and federal time. He's going to do a significant number of years in prison after he was found guilty of inappropriately filming minors. More details on that after the break.